Good Morning Doctor, brought to you by Parkway Shenton. You and your family's health is our priority.
Good morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good morning, Singapore, and welcome to my favorite segment for the week. It's always Good Morning Doctor, every Wednesday at this time on The Big Show and The Big Show TV. And today, we welcome Dr. Chew Chun Yang, family physician from Parkway Shenton Hospital, to the Kiss 92 studio. Good morning, Dr. Chew.
Good morning.
Thank you so much for waking up. I'm sure this early rising is not unusual for you, right? Are you up this early usually?
Yes.
Okay, good.
You
All
look
right.
like an early riser. I mean, we don't know each other yet, but after half an hour, I'll know you very well.
That's right.
But you look like, and you just watch me. I'm usually quite good.
Okay, I'm watching.
Fingers crossed, I'm right. You wake up early in the morning sometimes and work out and exercise or run. Are you a runner?
More a walker.
Okay.
Yeah, jogger.
Yeah.
Yeah. Sometimes I do jog and run, and at the same time bring my kids to work,
Okay.
to school. Sorry.
To
Okay.
school.
Yeah, to school.
Okay, I have a very important question, Dr. Chew, for you. Do you snore?
Yes.
Okay, does everybody snore?
Yes. Indeed. Everyone snores at some point of time.
Okay.
Even babies, young children.
But Dr. Chu, women don't snore.
Yes. Everyone snores.
All the women I'm
Everyone's-
with say they don't snore.
Yeah, no. Everyone snores.
No, only the guys snore. They say only the guys snore. So if you think only guys snore, ladies, you see, the doctor just said you girls also snore.
That's right. So what actually causes snoring? Let's find out.
Okay, snoring is a sound that is being produced when the air passes through our upper airway, causing the vibration of our soft tissue, especially if the airway is narrow or partially obstructed. So producing this characteristic noise. Snoring sounds can be different in each individual. It varies from quiet vibration, whistling, rumbling, and snorting.
And
Oh, yeah,
snorting as well.
Yeah, right.
Thank you, Glenn, for
No
the sound
problem.
effects.
Any
yeah.
demonstration you want?
Okay,
I'll
okay.
try my
And the
best.
whistling one? Is that the one?
Actually, you're the whistler, no, actually.
No.
This lady can whistle very well, Angel.
Yes.
Yeah.
But that doesn't mean I whistle in my sleep.
But you can do it. You
That's
can just go. Yeah, there
that
you
turns
go.
up in cartoons as well, right?
But it's true.
when you-
I've heard that. I've
Yeah.
heard that before.
So, is it true that people with narrower airways are more at risk of snoring?
Yes.
Okay.
So generally, it's also due to genetic. Sometimes you tend to snore more if you have a family member who snores.
Oh,
Yeah.
Okay.
And some people are born with a small airway. There's a small jaw. And of course, another risk factor would be high BMI. More than 38% of people with BMI more than 28 will have some sort of snoring-related disease.
Okay.
so your weight has something to do with it as well.
Yeah.
But I've heard some skinny friends of mine snore, and when they snore, I feel like the whole house is about to collapse.
Yeah. Another common cause is nasal congestion. So due
Okay.
to like sinus or allergic rhinitis, or maybe when we are having a cold,
Right.
when there's a lot of mucus, so you can snore.
It's blocked, yeah.
Right.
Yeah.
Okay, that makes sense.
All right, let's continue to talk to Dr. Chew on the Big Show TV. Meantime, here's the sexy Tate McRae with two hands on Kiss 92.
Okay, Dr. Chew, so now that we've established that everybody snores, is it healthy to snore or is it unhealthy to snore?
Well, if it's simple snoring, it can be harmless if it's mild and occasional. But if it's loud snoring and it affects your sleep, then it can be unhealthy.
And affects your partner's sleep as
Wait,
well, right?
affects
Yes,
your
actually.
sleep. You mean, I've never heard myself snore.
Okay, so sometimes people who have bad snoring may stop breathing in the middle of the night when they're sleeping without them knowing. So that is the worry we have. And they may also be choking or gasping for air. Right. Yeah.
Okay.
So another problem that when the sleep is disrupted, they may go to visit toilet or wake up more frequently at night. So that has inadvertently caused disruption to their sleep cycle.
I see.
So what is the difference between snoring and sleep apnea?
Okay, sleep apnea is a condition where it usually indicates a more serious upper airway obstructions or collapse. Sleep apnea also comes with a bad loud snoring, and patient tend to stop breathing. Like I say, patient may tend to visit toilet very frequently. Not only that, they also have daytime symptoms like sleepiness. They fall asleep when during their routine activities.
Oh.
They may wake up with a headache.
Right.
Always feel unrefreshed and tired all the times. It can also affect their mood.
Wow.
Yeah.
I mean, so how do people because I feel like tiredness, sleepiness during the day, quite a lot of people may have it, moodiness, as you said. So how will we know? Are there tests that can be done as to whether you have sleep apnea or you're just tired all the time?
So the gold standard for diagnosis of sleep apnea include polysomnogram or sleep study. So traditionally, patients were admitted to hospital to perform these tests. In recent years, there are home sleep study where the vendor go to the house and set up the sleep study for you. And now we also have this home sleep study in Parkway Shenton. So we can even do it in the GP level.
In the what level?
GP
GP
clinics,
level.
yeah.
Okay. What does the test involve though?
So basically, this home sleep study is an AI-powered device. It looks like a ring that put on your finger. It will be asked to sleep for 3 nights, and you come back with a doctor for a report.
Oh, I see. So it's so easy then. I mean,
Yeah.
I just get the ring and then I just go home and I sleep and over 3 days and then go back to you and you'll just be able to download all the data.
It's no longer
Yeah,
like
right.
those electrodes and all that you stick on your body and all that we used to watch on TV, right? Now it's just a simple ring.
Yes.
Wow. Okay, that's very convenient.
Yeah, very convenient.
Yeah,
Everyone should
anyone
go for
can
it
do
then.
it. Yeah. So when it comes to men and women, because women are always like telling the men, "Oh my goodness, you snored all night. I couldn't sleep," and then men are like, "Yeah, but you snored as well." Women are like, "No, women don't snore, right?"
Yeah.
So does snoring
But
actually?
women actually, when they snore, it sound like cappuccino machines.
Indeed, men is more common to have snoring than women.
Why is that though?
To male to female ratio of 2 to 1.
Oh wow.
Okay. Some of the hypotheses include the male sex hormone androgen may play a part in the upper airway muscle tone and control. Perhaps the fat may be distributed more centrally in male compared to female. So another reason could be that there is underdiagnosis of the women. The symptoms of sleep apnea may be more subtle in women. They do not tend to snore loudly, but they may have wake up early morning or other symptoms of sleep apnea. So when it's more subtle, it's a bit more difficult to diagnose. And of course, the reluctance to seek medical help. And 90% of sleep apnea are underreported.
Yeah.
Yeah.
The thing is, I think when we hear our partners or wives or whatever, snoring, most of the men will go like, "Ah, yeah, so
It's
cute."
okay.
It's like,
Because we're so
"Oh,
quiet."
yeah." But then when we are snoring,
They're so
straight away
noisy,
they reach
yeah.
for the pillow to suffocate.
They try to.
Yes.
For your info, women may actually get snoring more snoring after menopause. So one of the reasons could be the reducing estrogen and progesterone may cause the muscle relaxation more, and also the distribution of body fat as well.
Oh, right. Okay. So is there a cure? Because we've seen all sorts of things like this tape on the nose and all sorts of contraptions that you can buy off the shelf or even online. Are they just myths, or do they actually solve snoring issues?
And don't say sleep in separate rooms. I think many
not-
couples do that
That's
now.
not a solution.
Okay, so I'm aware that there are nasal strips, but so to date there is lack of data, studies to support the use of nasal strip. Nasal strip is believed to open up the airway, but sometimes it may cause irritation to the nose. Yeah, so it is not a cure for sleep apnea. So it may be used in mild snoring. Yeah. So, but
So it does help
you
a
should
little
get
bit.
you may want to get checked with the doctor if you have a bad snoring.
I've never used nasal strips. What are nasal strips again? How do they work? How do they open up the?
They tend to open up. They put a strip onto the nostril.
Okay.
Sorry, the nasal bridge. You may try to open up the airway. Yeah.
Is
by
it
tractions.
magnetic or what?
I don't know how it opens out.
Yeah.
It looks like
Yeah.
one of those blackhead strips.
I
you know?
see.
Yeah.
I see some people just put it over the bridge, right?
Yeah.
That's it. But I've never really understood how it
How it
actually
works.
Yeah,
What
that's
about sleep positions and all that? Because I know, like when my dad used to snore, my mom always would push him and say, "Turn around," because if you sleep on your back, then you're more at risk of snoring louder as well.
Yeah. So when we sit on our back, our tongue in some patients may tend to fall back and therefore causing the obstruction of the airway. Yeah. Sipping to the side may reduce the snoring or improve the sleep apnea. Yeah. So you may have heard of some anti-snore pillow. There are some limited study to show that it may help in some mild cases.
Okay.
Anti-snore
So it
pillows.
encourages you, I think, to sleep
The
on the side.
contour. Oh,
Yeah, the contour. So they
Contour.
try to reposition, your upper airway.
Right. Okay.
Yeah.
Okay.
I don't like those pillows.
No.
Sometimes it's like, oh, it's a bit high, hurts the neck.
Yeah.
and
Doesn't give you freedom.
Very particular about my pillows. Can't just use any pillow. Okay, let's go for a traffic update and then we'll go back on air. Okay, doctor?
Yeah.
Kiss 92 traffic.
If you're on the PIE heading towards Tuas, look out at the KJE BKE exit. A vehicle's broken down. Also on the TPE towards the PIE, an accident after the KPE exit with congestion all the way to Pongal. Avoid lanes 1 and 2. Hopefully everyone's okay there. If you have any updates for us, WhatsApp us 88550920.
Good morning, Singapore, and welcome back to The Big Show and The Big Show TV. Today on Good Morning Doctor, we have Dr. Chew Chun Yang, family physician from Parkway Shenton Hospital, and we have been discussing snoring as well as sleep health. And now I want Angel to simulate
The snore with the whistle?
Yeah, snoring. Okay, so if you were to snore, is that how you'd sound?
I haven't recorded myself just yet, but
Yeah.
I'll do this study for you over the weekend. How about that?
I think for us,
I
when we make the sound, like someone says, okay, make the sound of
It's probably
snoring.
very close to what
It's
you
very
sound
close.
like. Yeah. Mine's more like a... Yeah, that's it.
Okay. Today, before we continue with the doctor, let's hear how
Everyone
all of
snore?
us probably sound, in bed. Okay, Shalini Susan. First, my producer, Shalini Susan.
Come on, Shalini, do it. This is like...
Okay, how? I'm going to have my microphone.
Come on.
I don't know. Maybe
Okay. she sounds
Cappuccino
like-
machine, is it right?
She sounds
Cappuccino
like she's
machine.
going to eat somebody.
Nandita,
Do the snore.
my cute Nandita.
I don't snore.
Oh,
yeah,
no,
that's
no,
what
no.
you think.
Yeah, everyone
Okay,
snores.
but okay, can you make the sound of snoring? So cute. Cheyenne Lim. Come on.
Okay, we have a couple of...
Here's the king.
Oh, no, my gosh.
Okay.
We didn't want that. Okay, we have a couple of questions on our Big Show TV.
Okay,
So we have
for the
Joyce.
doctor?
Yeah, for the doctor. So we have Joyce that's asking, "Hi, doctor. If the snore sound is like being drowned in their saliva, is there something to worry about?" I suppose I'm not sure what that sounds like.
Yeah. Well, snoring can, like I say, snoring can be different in each body, any individual. So any abnormal sound, that is produced by the vibration of tissue, is as a cause of concern, especially if it disrupt the patient's sleep. So please monitor for other, symptoms of
Like?
apnea, like gasping, choking, stopping of breathing. So all these matters as well. So if we are not sure, sometimes we advise our patient to visit us so that we can do some kind of assessment. So one of the assessment that we often do questionnaire would be the stop bang questionnaire.
Stop?
Yeah, stop bang questionnaire
okay.
is a screening tool that we sometimes use to screen for sleep apnea.
Okay, that sounds interesting.
You know, I can't believe this day and age, we still can't solve this problem.
The snoring problem,
like you
right?
mentioned, right? Like soft tissue and all that. Like, can't people go for like a surgical procedure to remove the extra soft tissue or something like that in order to not snore? Because snoring is causing people to get
Fight.
divorces.
Yeah.
And I think it's a major problem. Not sleep in the same room and then slowly drift apart, and
Yeah.
so it's destroying relationships. And yet, we can't seem to have, an instantaneous solution to it.
Is there a cure for snoring?
Well, there are many interventions that we can do for snoring. So first of all, we need to know how severe is apnea causing the snoring, right? Some of the intervention that we can do is lose your weight. Lose weight if you have high BMI. Yeah, exercise. So exercise regularly can improve the upper muscle motor control, as well as improve overall general health. Yeah. Next, you should also quit smoking, as well as avoid consuming alcohol, and try to minimize taking sedative pills or sleeping pills.
Oh, like
Because,
melatonin and stuff like that.
No, it's more like those the Z drug,
The
Right,
actual,
the actual sleeping pill.
Okay.
So all these can also increase the relaxation of the muscle, causing increased risk of sleep apnea.
Okay, all right.
You
Then,
see, when you're relaxed, it's supposed to be a
Yeah.
good thing. But
Yeah.
then too relaxed also is a bad thing.
Yoni is asking where she can visit you because she wants a consult.
oh, okay. My clinic is located at Parkway Shenton, Serangoon.
Okay. Parkway Shenton, Serangoon, Yoni.
Yeah, of course. There are also other interventions that you can do beside the repositioning therapy, like sleeping on your side can help. There are also other methods to help patients with sleep apnea. For example, putting on an oral appliance. So, for example, the mandibular advancement device or the tongue stabilizer device. Usually, these devices will be advised to fix after customization assessed by the sleep specialist or the ENT specialist.
Wow.
Right. So don't go on like your Lazada and Shopee and then go and buy.
No.
Yeah, it doesn't work that way. It needs to be customized for you.
Surgery is one of the intervention, but usually we reserve for more moderate to severe sleep apnea, although some of the methods has already failed earlier.
Okay. Let's continue to talk to Dr. Chew on The Big Show TV. It's 8:23.
Kiss 92 Time Check brought to you.
Celine Wong on our Big Show TV has said, my family member has a CPAP machine. What is a CPAP machine? That doesn't seem to work for them.
Okay, CPAP is a well-known treatment for sleep apnea. CPAP stands for continuous positive airway pressure. As the name implies, the machine will continuously pushing the air into the upper airway, helping the patient to sleep better and open up the airway. So there are two types of CPAP machine comes with mask and the machine, and there are two types. Fixed pressure. The other one is auto adjust. Nowadays, most people do use the auto adjustable pressure.
Okay.
However, it also comes with some problems. Some patient may have problem adjusting to the machine early on, and another common problem is air leakage. Yeah.
So you're actually sleeping with the mask over your face.
Yeah, right.
Almost like an oxygen mask. And then you're breathing in. Okay. So we have an air filter in our room. And apparently since it's been on and facing me, so the wind is facing me almost like a fan, I have stopped snoring at night. Does airflow like that actually have any effect? Because to me, my husband's like, oh, let's leave that there because, you make no noise anymore. So that's a good thing. Have you ever heard of that with any other patients?
There is no last study to show that airflow on the face will help that. Well, I think it's good to hear that.
Yeah, so
but CPAP is one of the recommended treatment for sleep apnea.
Okay. CPAP.
I think you definitely look better with the fan blowing on you than if you wear or depend on the CPAP.
No, of course. No, I'm not using a CPAP. I like my
Right. Also, is your fan
Purifier.
noisy? If your fan is
No,
noisy,
it's a-
maybe that's why your husband can't hear you
No,
snoring.
no, it's an air purifier. It's a Dyson air purifier. Literally, it's like a fan, but it purifies the room as well. So I'm just wondering, is it a clean air or is it the wind? from the fan, like what it is that affects the breathing that doesn't make me snore anymore.
Maybe your
It's a good
husband
thing.
is just
Maybe he's just being
deep
nice.
sleeper.
Yeah, maybe he's just being nice. Okay, so how can we prevent snoring? Is there any way to prevent it?
Yeah, first of all, please lose weight if you have high BMI, because it is really high incidence in Singapore that we have some sleep apnea. Even there's a study done by Dr. Adeline, Jurong Health. Recent study shows that 1 in 3 Singaporean will have moderate to sleep apnea. So it's indeed very common. Yeah, so obesity is also one of the main problems that we are facing. So please lose weight, that's number one. Like some of the lifestyle intervention that as advised earlier, stop smoking, alcohol, avoid sleeping pills, all these may help and prevent sleep apnea.
Okay.
Almost everybody drinks these days. Maybe that's the reason why more and more people are perhaps snoring. But as the doctor says, as the good doctor said earlier on, snoring is normal. Okay,
Yeah.
it's just the degree in which you're snoring, the type of condition you might have, sleep apnea, or that's the most
Or
dangerous,
just snoring,
right?
yeah.
That's the most dangerous.
Yeah.
But other than that, if you're waking up refreshed, you don't feel tired, lethargic, and all that, I think that's a good sign that you're not really in that level of danger in terms of the condition, because sleep apnea can be very
fatal.
dangerous.
It can be fatal as well, right?
Exactly.
Yeah, because it kind of when we stop breathing in the night for sleep apnea patients, so we have a low oxygen saturation in the blood, and it also triggers our brain to wake up briefly to open the airway. So when that happens, the sleep cycle is disrupted. When we have a poor sleep, there are many health issues that comes with it. So it causes increase in inflammation and damage to the body. So some of the problems, it can affect our brain health, increase the risk of dementia, depression. It can affect our productivity, increase the risk of road traffic and work-related accidents.
Oh my goodness.
Yeah.
Wow. Okay.
It can also affect our heart, increase the risk of hypertension, heart attack, irregular heart rhythm, heart failure, lungs, liver, kidney,
Wow.
progression of kidney disease.
Yeah.
Oh my.
And in fact, it can also affect the sex drive of human.
Of people. Yeah. You were talking earlier about like sleep apnea sometimes making people choke, because you choke
Yes.
on your own saliva and all that. I think we've all been through it as well. Like when you're sleeping, all of a sudden you're like, and then you cough because you've sort of like choked on your own saliva. Is that a sign of sleep apnea, or does everyone kind of go through that? Because, sometimes you just, it almost like goes down the wrong airway, it feels like that.
Is that confirmed, sleep apnea?
No, I don't know. I don't know. That's what I'm asking.
Yeah, so that when someone chokes, when they are sleeping, it raises a suspicion of sleep apnea.
Oh, it does.
So
Okay.
it should get assessed.
But not if it's like once in a while. If
Yeah.
it's like every day, then you get it checked.
Yeah, if it's persistent, prolonged period, should get it checked out.
Okay. Yeah. Okay.
We're going to go on air one
Yeah.
last time. Any more questions from our listeners?
Yes, we do have someone from Angie. Angie is asking, does a person have to be sleeping deeply before they snore? Or does it happen with just when you're falling asleep, like light sleeping? Or it doesn't matter?
I think it doesn't matter.
It doesn't really matter.
it doesn't.
You were talking about sleeping positions earlier, like on your side, you're not at much as at risk of snoring. What about people who have very serious, severe apnea? Would sitting up or raising your head more minimize the snoring?
It down to the position of the sleep when of how you open up the airway. Yeah, sometimes yes, opening if you tilt your head
Back more,
yes,
right?
correct.
Yeah,
Yeah, then
that's
you
better.
may breathe better. But it also indicate a more serious disease, and then you should really get it checked out, because then it shouldn't,
You shouldn't have to sleep like that, right?
because
Yeah.
you shouldn't sleep.
Just
have a
sleep with your head
yeah.
hanging over the bed or something.
Correct,
But
yeah.
right, that's why those pillows are made like that, right?
The contour pillows, right?
Because they lift your neck up.
Yeah, but they hurt my neck. I don't know why. It's like the next morning I wake up, I don't feel, I don't feel well rested. I feel like my neck is aching.
But you're meant to sleep with
For me,
your
I
back.
need to use my normal like feather pillow, that is not
soft?
so hard, not so soft. I like my head to like sink in a little bit, and then just feel really comfortable. Yeah, so I've got
Questions,
I think like
okay.
maybe 20 pillows at home actually.
Of
I'm
course
still
you do.
trying to find the ultimate pillow.
The perfect one.
But I always go back to my pillow.
Okay, we have a question from you. Is OSA only classified as an obesity link? This you would understand? No?
OSA.
Yeah, reason I note, I don't know what reason I notice is that insurance companies have changed the classification under obesity and it's no longer claimable. I'm not clear how it's been done in the category. Please share if there are any known specific reasons.
Oh, we don't know insurance.
Insurance is not,
So
the
you
doctor
go-
is not an insurance agent.
That's
so
right.
You'd have to ask your insurance agent about that.
Sorry about that.
Yeah, thanks
Thank
for
you.
that.
Thanks
Yeah.
for your question. All the same. Okay, we are going to go for a traffic update, and then when we come back, we'll wrap.
And we got just one more question on WhatsApp.
Okay.
This is my fault. Look me in the eyeball. Next time I'll lay my fist at the drywall. Next time there will be no next time. I apologize, even though I know it's lies.
I love the way you lie.
Kiss 92 traffic.
On the KJE towards the PIE after the BKE entrance, look out for a broken down vehicle. Also on the ECP towards the city, another vehicle having trouble after the Rocher Road exit. Avoid lane 4. Wherever you are this morning, stay safe.
Welcome back to The Big Show and The Big Show TV. Our guest for this morning is Dr. Chew Chun Yang, family physician from Parkway Shenton Hospital. And we've been having a very good discussion about snoring and sleep health. The only surprise to me is that, we didn't have more wives message us, because I'm sure the wives want to try and
Stop the men.
not put on earplugs when they sleep anymore.
Yes.
Perhaps they've given up hope already.
Perhaps, yeah, but they're sort of living with it now. But we do have a question from Winnie, who's talking about her 3-year-old child. She said once her 3-year-old child had her tonsils surgically removed, it seemed to solve her snoring problem. Have you heard any relation between removal of tonsils and snoring?
Yes.
Okay.
So these fall into the category of surgical intervention for sleep apnea. For severe cases, sometimes patient will be assessed by the ENT specialist or the sleep specialist. They look at our sinus, the nasal cavity, and also the throat. So some of the surgical intervention include the sinus surgery, the throat surgery, and tonsillectomy is part of the throat surgery. There's also a base of tongue surgery, or they even have this mandibular advancement surgery. They open up the jaw, make it the airway bigger.
Okay.
And there is recently we also have the hypoglossal nerve stimulation. That means they put a device onto the chest wall to stimulate your tongue, so to prevent it from falling backwards at night. Yeah. And the last resort would be the tracheostomy, which is opening up a hole in our windpipe, so that basically you bypass your upper airway, so you breathe through your windpipe. So it is quite an extreme case. Rarely patients accept this.
But there are quite a lot of options out there for people who have it serious.
Yeah, I think those procedures you just mentioned will definitely change my voice.
That's
if I
an
go for
interesting thought. Does it change someone's voice though?
I don't think so,
No,
because
okay, you're fine.
our voice, your beautiful voice, is controlled by your vocal cord.
So nothing to do with the
I
vocal
see.
cords.
I don't think it's a surgery for the vocal cord.
So even if I remove my tonsil, I'll still sound like this. I always thought,
No, it's the same because it's not your vocal cords. And you
Okay.
don't need your tonsils, so
all right.
yeah.
Okay.
Thank you, doctor.
Okay, now I know. Okay, before we let you go, any advice to people who are going through this issue right now, snoring, but they don't know whether they should consult a doctor or not?
Yeah, my advice to you is that if you snore badly, it affects your sleep, and you're not sure about it, or your partners are having a lot of bad time with snoring. So please see a doctor, because we are here to help you. We can help, we can diagnose a problem, and make you better.
Okay, very cool.
Thank you very much. We've been speaking to Dr. Chew Chun Yang, family physician from Parkway Shenton Hospital. Thank you so much, doctor, for joining us today.
Thank you.
All right. Coming up very, very soon, we'll be introducing Daniel O'Connor as well as Jake Camacho, and we'll be talking about the forthcoming Sunda Festival here in Singapore.
Thanks for prioritizing you and your family's health by tuning in to Good Morning Doctor. Brought to you by Parkway Shenton. You and your family's health is our priority.
The Big Show with Glenn and Angel on Kiss 92.
Jason Derulo. Come on, shit. Everybody's looking for love.
All right, the gentlemen are in the studio right now introducing Daniel O'Connor, co-founder and general manager of the Sunda Festival, as well as Jake Camacho, the co-founder and head of marketing. Welcome, guys.
Thank you.
It's a pleasure to be
nice
here.
to be here.
Tell us a little bit more about the Sunda Festival, please.
Jake.
Anyone.
All right. So Sunda Festival is a multi-day music and arts festival. We spotlight regional talent. Our musical focus is on alternative dance music, but in addition to the music, it's designed to be much more of a holistic experience. So we have activities that appeal to all ages. It's actually family friendly.
Okay.
Of course, we have food and drinks and arts as well. So just a really exciting festival that we're very excited to share with you all.
And I'm picturing, I don't want to drop any other festival names, but I'm kind of picturing like a Burning Man / Coachella type thing. Is that what it's kind of going to be like, except family friendly?
It's a very like intimate festival experience. So
Okay.
I think, like when people think of music festivals, they think of like 10,000 people packed into, a big stage.
Yeah.
For us, it's spread over like a large campsite, so it's a very natural setting. It is very intimate. It's designed to be intimate. We want people to connect with the space, with the music, with the program that we have. So I get where you're coming from. I think, but it's a very different type of festival experience to I think anything else that's in Singapore at the moment.
It's not the first time you're having this
Sunda.
festival in Singapore, right?
No, we did the first edition in 2023. So it was at Sarambun Scout Camp over 2 days. There's also a camping element as well, which is why we kind of picked the site.
Right.
That was received really well. So we took a little bit of time to come back for the second edition. It's obviously a big project. So. But we did a warm-up event in October 2024 at Haw Villa, which was like a kind of one-stage, one-day format.
At Haw Villa?
Yes.
Wow, okay.
Yeah. So we like to pick places that are kind of like forgotten or hidden spaces that, people typically wouldn't go to for music events.
You say intimate though, but how many people are you expecting?
It'll be anywhere from about 1,000 to 2,000 people per day.
Okay.
So
okay.
it's
not too bad. It's not like a
it's
10,000 thing.
No. Definitely very intimate. Our hope is that as you're going around the festival, you'll start to recognize familiar faces, and we like to have that sort of community feeling at our events. That's definitely the sort of vibe that we're going for.
Okay.
I'm going to set up a tent.
That's what I was going to ask
Come
about.
back to my tent.
Like in Singapore, you need a license for everything. So do people need permission for these tent setups, or you just bring your tent along and you pitch it anywhere?
So we've chosen Sarambun Scout Camp because it's one of the largest, it is the largest and the oldest campsite in Singapore at the moment, and it's run by the Scouts Association. So they have actually, they have the permits for camping.
Okay.
And they also have built infrastructure on site where you can stay in either air-conditioned or fan huts. So there's something for everyone depending on the level of comfort you want.
Glenn wants the air conditioning.
Yes, definitely.
For sure. With a loo close by.
100%.
Private bathroom and everything.
Okay, let's go on air.
I got a lump in my throat, 'cause you're gonna sing the words wrong. I got a lump in my throat, 'cause you're gonna sing the words wrong.
Kiss 92 traffic.
All right, on the SLE towards the CTE before the Woodlands Avenue 12 exit, avoid lanes 2 and 3. An accident has been reported. Hope everyone's okay. On the PIE towards Tuas, a broken down vehicle has been spotted after Jurong East Avenue to avoid lane 4. If you see anything else, our number is 885550
All right, welcome back to The Big Show and The Big Show TV. Our second guests are Daniel O'Connor and Jake Camacho. They are here to talk about the forthcoming Sunda Festival, of course, being held, let me see now, the weekend of Easter. Easter weekend. It starts on Thursday, April 17th, and that's the opening night. And the main festival days will be Friday, April 18th, and Saturday, April 19th. We're really, really excited about this. It's a multi-day alternative dance music festival in Singapore featuring the best DJs and live acts. Who are some of the DJs and live acts? Daniel. Jake.
Jake is more the music guy.
Okay, Jake, tell us.
Yeah, so we, part of the mission of the festival is to celebrate regional talent and to bring together the different regional creative scenes. So a big part of our lineup is dedicated to, obviously spotlighting people from Asia Pacific. So we have DJs coming in from Korea, Japan, Indonesia, Philippines, Thailand, all over the region. So we're really excited about that. Of course, our local cats are represented as well. We're working with a lot of the local collectives. And then there's also a sprinkling of international talent coming in. So we've got Danilo Plesso from Germany, Antal from the Netherlands. And this is kind of a broad spectrum of dance music. So everything from the more funky, upbeat stuff like house and disco down to the more sort of dark, clubby sounds, but also live acts and live bands that will be doing a range of things from, soul, R&B, hip hop, and so on. So, a very good mix of stuff.
Okay, so opening night happens on Cecil Street at a place called Modular, right? MDLR, it's number 62 Cecil Street. And then the main festival is at Serimban Scout Camp, which is all the way out near Lim Chu Kang or Chua Chu Kang or one of those areas out there.
Yeah.
But walk us through what will go on at the festival and who is this for?
Yeah, I mean, so as Jake mentioned, we have like multiple facets of the festival. So we have the DJs for more of the party crowd. We have the live music programming for people who want to chill a bit more. And then we have an activities program that's built around the themes of creativity, wellness, and family-friendly fun. So we have everything from workshops that are meant to kind of get your creative juices flowing, songwriting workshops with local band Mantravine, who are kind of into like sort of psychedelic fusion, and then family-friendly activities like we have a scavenger hunt that's being put together by Keen, the footwear brand, and Play, where people have to go and find little Easter eggs around the site to win prizes as well. So there is a little something for everyone. Everyone from people our age to older cats who used to enjoy partying and want somewhere to do it in a more chill environment. For families or the local cool kids. There's something for everyone to enjoy. Obviously, no festival experience is complete here without food and drinks. So we have Psychos sausages coming in. We have a local company called Bougie Botanicals coming in to serve like kind of healthy elixirs and snacks, and then obviously the kind of more Asian-leaning food with Just Two Friends and Hoodlamak, who are doing like rice-based dishes and jazzed up Indomie as well.
Ooh, sounds fantastic. If you want to find out more, you can head to their Instagram, sunda.festival, or their website, sunda, spelled SUNDA, festival.com. All the information is there.
Right. Is that where they can get tickets as well?
Yes. So they can find tickets at our ticketing info at our website, sundafestival.com. All the information is there, all the FAQs, all the lineup, everything you need to know is on the website.
Okay. What time does it run from until, like on Friday and Saturday?
The Thursday event, which is the opening night, that's a nighttime event. So it's from 10:30 until late.
Okay.
And then the sort of main festival at Serimban. On the Friday, it starts at 1 p.m. and it goes all the way till 4 a.m.
Okay, and then on Saturday?
And then Saturday is 10 a.m. till 4 a.m. So it starts a bit earlier, just in case you're one of the campers or something. Then we've got stuff for you to get involved in as well.
Right. How many slots do you have for the campers? Just out of curiosity.
So we have accommodation-wise, there's 20 huts, which can sleep up to 6 people each.
Oh.
And then there's probably room for about 30 tents, which are meant to be sort of 4 to 6 people as well.
So these are bring your own tents, or the tents are already set up there?
So you have the option for both.
Okay.
So the venue has plenty of tents that can be pre-pitched if you book it, and then there are also spaces for people to come and bring their own tent if they're seasoned campers already.
Sounds like fun, actually.
Yeah.
Wonderful. Okay, so once again, it's happening Easter weekend, opening night Thursday, April 17th, and then of course Friday, April 18th to Saturday, April 19th. Sunda Festival 2025 is going to be bigger and better. Thank you very much, Daniel, and thank you very much, Jake, for coming in today.
Thank you so much.
Thank you so much.
Thanks,
We'll
guys.
see you at the festival.
Yes.
I'm going to book one of those huts, that's for sure.
This is brand new.
Here's a tune that's fresh this week on Kiss 92.